Good evening, everybody. Welcome back from that fantastic summer holiday. I went to Wales, had a week of sunshine, so there you go. Can't go wrong. We're three missing, but we are quorate and they are expected, so we'll make a start. And this is our first proper meeting. It's exciting, isn't it? So welcome, everybody. Hopefully some fun over the next 4 years and scrutinise the council, not the officers. So first things to a few things. When you're talking, press our microphones, please. Mobile phones off, please, and on silent. We've had one apology from Councillor Knight, but Councillor Mason is replacing them when he gets here. Not expecting any members of the public, so don't go through the usual how to get out the building in case of a fire or a bomb or anything like that, so we're fine. And I think we all know the toilets are behind my left shoulder, so if we need to go, away we go. That's good. Declarations of interest. Councillor Waller.
Thank you, Chair. Although they are already on the register as they are mentioned in the report here today, I'm a governor at York High School and at Westfield Primary School.
Thank you. Councillor Gusperson.
Thank you, Chair. I declare an interest as a governor of Headlands Primary School. It's already on my register.
Yep.
Thanks, Chair. I just want to note I've got a child in year 6 and a child in year 9, both as of today, which is quite terrifying. Yay. But there we are. And I've got a non-registrable sensitive interest with respect to agenda items 4 and 5, for which I've taken advice. I'm comfortable that I've got no conflict that would prevent me taking part in this evening's meeting. Cool.
Oh, yep.
Thank you, Chair. I'm not a member of this committee, but I think I'm going to be turning up every time. So I'm going to say this at this meeting in the first of our sort of formal meetings, and I don't intend to repeat myself every time this becomes an issue unless it is very clearly an issue. But I am a teacher at Archbishop Holgate School and therefore an employed member of Pathfinder Trust. Again, I'm not obviously a decision maker on this board, but will turn up on a regular basis. So I thought it's worth saying that here and now. And of course, if there is anything specific, then I'll make that clear. It is on my register of interests, but I just wanted to make that really very public here and now so that I don't have to repeat myself again and again. And if that is an issue with anyone, then I'll happily take advice on that after the meeting. But thank you very much.
Always good to have a teacher. That it. Excellent. Minutes of the last meeting, which is going to be good because most of us weren't even elected at the last meeting. So they have been published, obviously, and I've not been made aware of any issues from those minutes of the last meeting. So if we're all happy to pass those, thank you. That's a sign. Right, public participation. We have one, which is good. The online, and it's Flip Williams who wants to talk about item 5. I think it is it? So, Ollie, dial us in.
Good afternoon. Would you like me to begin?
So yes, Flip, I didn't know you've got 3 minutes. Sorry, I ain't put my microphone on. Apologies, Flick. Yeah, you've got, yes, you're ready to go, Flick, and you know you've got 3 minutes or up to 3 minutes.
This report on school inclusion starts with a fundamentally flawed premise that the pandemic is over. That may be the government narrative, but it is not the truth, as this autumn will inevitably reveal. The infection rate is rising again, new variants circulating and resulting sickness absence inevitable. The Department of Education focus on attendance is fundamentally ableist. Children and young people who are largely unprotected by vaccination, who may be clinically vulnerable or have family members who are being expected to attend school without mitigations of masking, clean air ventilation, or the requirement of others to stay home when sick. Those of us who are vulnerable to COVID know what others are reluctant to hear, that every infection risks death, long COVID, and irreversible organ damage. We are all now in this perpetual and involuntary high-stakes game of chance. The narrative that children are unaffected by COVID is also a dangerous myth. There are now estimated to be 65,000 children in this country with long COVID. They now join the ranks of disabled children with their already long waits for AIDS adaptations and services. Children who require healthcare are just as affected by record NHS waiting times as adults. I read about children needing hospital-based dentistry or having to wait up to 2 years for treatment, living with dental pain hardly conducive to school attendance, learning, or perfect behaviour whilst there. Threats by ministers to remove child benefit for non-attendance only adds to the growing mental health crisis among parents and increased poverty for already socially deprived families. It feels like a race to the bottom. And unsurprisingly, the gap in attendance between non-disabled children and those with the SEND label grows ever wider. Persistent absence, as the government prefers to call it, is of course a safeguarding issue, but you cannot square that circle whilst many parents justifiably feel that school is not a safe, supportive place for their children to be. And against the rhetoric of driving up attendance, we have the reality of those who don't actually have a school place to go to. I'm aware of one such disabled child as term begins. The mother is seeking a place in mainstream as she believes the child will be failed by being placed in segregated provision. She does not wish her child to be warehoused, as she puts it. I concur. After all, there is no special world for disabled kids to enter on leaving education. And so begins a lifetime of exclusion for this little disabled person and a lifelong fight for everything by his mother. I tried to persuade her to speak here today, but she feared becoming too emotional. As the whole education system creaks and groans from the pressure it is under, from underinvestment and a growing staffing crisis, it is disabled children who inevitably bear the brunt of that. Failing disabled children today is a guarantee of creating the dependent adults of tomorrow. Thank you.
Thank you, Flick. Much appreciated. Any questions? Any comments? Lovely. Thank you. Okay, item 4. SEND report from.
Thank you, Chair. I'd like to introduce my colleagues, Julie Frost, who is our head of integrated SEN and joined us back in March. And obviously Dan Bodie, who's our school inclusion advisor. We're very much here as a team this afternoon because of the important work that we do together around these joined agendas. So yeah, we're delighted to be with you in Scrutiny this evening. I'm going to deal first of all with agenda item 4, but I will be asking for Julie to also provide additional comments from the work that she's doing at the moment leading on SEN. Just to set the context, in 2019, as a local authority, we were inspected alongside our partners in health by Ofsted and the CQC under the local area inspection framework for SEND. That looks at the partnership working around the implementation of the reforms within the 2014 Children and Families Act, which led to the introduction of education, health and care plans and a number of other reforms. The purpose of that inspection was to look at how successfully local areas were implementing those reforms. And as a result of that, there were areas of weakness which were identified in York across the work done by local authority and health partners. And we were asked to prepare a written statement of action, which would target improvements in the areas where there were felt to be significant weaknesses. We were given 18 months to 2 years to actually complete that improvement journey. And that written statement of action was actually produced, submitted and worked on completely during the process of COVID lockdown. And so our improvement journey tracks entirely the period that the country was subject to COVID. That's an important context to understand. When we had our inspection revisit, they were looking at work that we achieved as a local area partnership, when that local area partnership was under significant challenge. Our colleagues in health were, all of them were in the front line of services being prioritised around the COVID pandemic. And obviously, as a local authority, we were also in the forefront of working with our education partners as they were also putting in place really quite significant actions around mitigating the effects of COVID. So we felt that it was a real achievement, given that journey was conducted completely under those conditions, that when Ofsted returned in November of 2022, they removed the written statement of action and said that we had made significant progress in all the areas that they originally were concerned about back in 2019. It was against that we also then thought about the next stage of our improvement journey, which was to build on what we'd achieved as a local area partnership, working together on that written statement. And one of the things that Ofsted and CQC asked us to do was to write an operational plan which sat across the partnership, because what they'd said was that they could see that health and the local authority had got separate operational plans which drove aspects of our SEND strategy, but that what they wanted to see was an operational plan which outlined actions which showed the way that we were working together to deliver the SEND strategy, which again was also written under COVID lockdown conditions. So it wasn't the way that we would have normally wanted to produce a SEND strategy, because we weren't able to do the normal engagement events. And that's one of the things that, as we are moving into reviewing and starting the work on refreshing our SEND strategy, is going to be very different. And we will start that work from January onwards to have a series of engagement events which help us to both review where we've got to with the implementation of the SEND strategy, but also set the actions from 2025 and onwards. So it's when we're looking at the current operational plan, it's anticipating the fact that we are both working on a SEND strategy that's currently live, but we've also been thinking about how do we move beyond that, and how do we build on the momentum that we created working on the written statement of action, and that we don't lose any time in embedding and extending that improvement activity. The operational plan which you have, we've provided some updates around where we've got to, and one of the things that we very much want to do is make sure that we are building, as I said, building work streams which take us beyond our current SEND strategy and set up our ambitions for the future. We're referencing those against the fact that the inspection framework has changed. So since we had our inspection revisit, a new inspection framework has been introduced. That has considerably raised the bar in terms of what will happen when we are next inspected by Ofsted and CQC. It's very important to recognise that what's distinctive about the inspection of local SEND services is that they're an inspection of the way that a partnership works. So it's not just an inspection of the local authority services. It's also an inspection about the way that we work with partners to deliver and improve services for children and young people and families with SEND in our local area. And it's very much driven by the experience of those children and families. So the bit that we have no control over is what will happen when those children and families talk to Ofsted. And a big difference with the new framework is that it's very much driven by voice. That's one of the things that we are working on as we're thinking about how do we prepare for that new inspection framework, and how do we keep close to the voices of children and young people, parents and carers, particularly when part of this stage of our journey is about some of those things that are helping change some of our processes and practices. And a big part of that is the work that Julie's statutory team do around developing the education, health and care plans. We're really looking at how those education, health and care plans reflect the voice of the child and the young person. Because what we've recognised is that what we do very often get is the voice of the parent and carer, but the plan is the child's. And it's got to be meaningful to the child. They've got to understand why they've got a plan. And they've also got to view that plan as being something that is helping them to overcome some of the barriers that they have to achieving in their school or setting. So helping them to feel that that plan is written for and about them is one of the things that we're really working on with SEN caseworkers at the moment. That's also a really important thing in terms of the work that we want to do to ensure that there's a very strong focus in plans on preparation for adulthood. And so that's a piece of work that we're working in partnership with our colleagues in adult services around that. Because one of the things that's happened through the way that the SEN system works nationally is that it can feel quite disjointed and sometimes quite confusing to see how the different bits of the journey join together. And that's one of the things that we're really wanting to ensure that we, over the next 2 to 3 years, have really got right in York. And that that journey becomes much more accessible. There are no surprises, and that everybody understands what happens at each stage of it. Are we there yet? No, we're not. Because if we were there, then we wouldn't still have parents and carers and children and families, and good example from the public participation that we've had this evening, who still feel that it's a confusing system, and that you don't always see that it works in your interests. And that's very often where we're starting that dialogue with families about, well, why does it happen that way? And how do we actually change that system? And that's why we've been working very closely in developing our partnership with the new Parent Carer Forum, because one of the things that happened during lockdown was that a new Parent Carer Forum was formed. Again, their journey to be that cross-city voice for parents and carers with SEND is a story of how we help them to develop, working alongside them so that they can truly advocate and raise their profile. We now have monthly meetings established with the Parent Carer Forum, and those monthly meetings are about, again, looking at ways in which we can support them to better work in that space, not to direct what they do, but to look at how we can support them with some of the things that they're struggling with, because obviously they are volunteers. They do a fantastic job, but they're also doing it alongside being parents and carers of children with SEND. So they're very, very busy people. And as professionals, we want to ensure we're giving them the right type of support to develop their advocacy and their voice. That's a key part of our operational plan. We're also very dependent on them on helping us to review the things that we do and to help us all the time challenge ourselves to be better at what we do and how we develop and deliver the offer for children and young people with SEND in York. So the operational plan is in its very early stages because it was actually only finalised at the start of June this year. So we're more or less at the end of the first quarter of it, and it's in that context that it's really important to appreciate some of the work that's been done. Julie's team continues to evolve, and it's really great that Julie has joined us. She's a very experienced SEND manager who's joined us from North Lincolnshire. We're really lucky to get her because North Lincolnshire has got a very, very strong reputation around SEND. So we're learning all the time from the things that Julie's bringing as well. And I do want to as well celebrate the fact that during our COVID improvement journey, we also had a very strong head of service who, Sue Day, who wrote our SEND strategy, put in place an awful lot of the improvement work that we are continuing to benefit from. And Julie has joined us at a key point in our journey. We are still settling certain processes down. So the work that our SEND caseworkers, who are a relatively new team, again, they're developing their role all the time and becoming much more confident in it. And we still, hopefully, fingers crossed, are going to get our designated social care officer in place. We're in the middle of a recruitment process at the moment, which we are confident will end successfully on the 22nd of September. But that's a really key appointment, because one of the things that Ofsted asked us to look at when we had our revisit was making much clearer the footprint of social care within our SEND journey. And that's quite a crucial post. Many local authorities are still to appoint to what's called the DISCO role, the Designated Social Care Officer role, but we've been very proactive and in actually putting out a recruitment process and seeing it as really crucial to the next stage of our journey. It will report into Julie, who has worked with DISCOs before. So again, that's going to be a really important part of how we develop that work going forward. There is a strong interface between the work that Dan does in school inclusion and the work that the SEND team do. And what we want to always be doing is saying across our work in education skills, but also broader children's services, to develop that understanding that SEND is everybody's business. And just as we have corporate responsibilities around children in care, although there's no statutory requirements to have corporate responsibilities around SEND, I'm quite passionate about the fact that we should have. And that it's really important that elected members see SEND as their business alongside the work that you do to support children in care. And I know, I'm preaching to the converted, because I know that people do view that as being so important, which is why I was delighted that we were the first topic to be looked at by Scrutiny, because it is such an important piece of work for us as a council, but also for us as a city. Because as was highlighted by our first public participant, we want the city to be as inclusive as possible. And quite rightly, our children who have SEND are very, very valuable and important citizens, future citizens for York, which is why one of the things that we are looking at is how do we ensure that we're ambitious about them, and we're particularly ambitious about employment for them, and also that we're ambitious about the way in which they're included within their communities. And that's part of the work, again, that we're doing in skills around supported internships, but also thinking about developing the way that we develop a network of inclusive employers in the city. And that's been very important to our supported internship launch event on the 28th of September, where we've got a group of employers who are very publicly joining up to that commitment, because we should be ambitious about the fact that our children and young people we send do have some barriers, but they have some strengths. And it's those strengths that we want them to gain a greater understanding of, and that we're putting in place provision which helps them to use those strengths and build on those strengths in the right way, because we are putting in provision which addresses some of the barriers around their needs. And we're really on a real improvement journey as a team around getting education, health and care plans to be documents that make a difference, and that they're written in a way which makes it really easy to put that provision in place. It's also something that is written in plain English, which everybody understands and everybody can own. And it's work that we're doing through capturing evidence from the audit of those plans. So looking at those plans, what needs to improve? And every week we're doing that when we're in decision-making panels about, is this plan good enough? Is this plan actually going to make a difference for this child? And that's really what we're putting at the heart of the journey that we're doing. Martin always challenges us with questions around, would this be good enough for our children? And we're very much taking that on board in terms of, when we're looking at plans, would we want this plan for our child? And that's really going to be the benchmark around how we're confident that when we look at a plan, is this the right plan for this child? And working alongside children and young people, parents and carers, that's going to be the benchmark, and that's going to be the test. So I'm going to leave it there because I want to leave time for lots of questions, but Julie, if there's anything that you want to add.
Yeah, I just wanted to say in terms of the services that I lead, that also includes the statutory team that do the education, health and care planning and reviews, but also the specialist teaching team. And we've got a huge sort of bounty of knowledge there, really. We've got, teachers who are specialists and working with schools and parents and children and young people with autism, with hearing and visual needs, portage for very young children with physical disabilities. We have a real strength really within those teams, and I think it's something that's really valued within schools, and we get some really positive feedback. We also have the educational psychology team, and they support schools in terms of identifying young children and young people with needs and supporting some of the strategies that sort of SEN support. So we're looking at the universal and targeted, as well as identifying that children who've got more specialist needs who might require an education, health and care plan. So there's a real kind of strength across, and I think that links in with Dan's team as well with inclusion, when we're looking at not only how we support children and young people, the specialists, who have an education, health and care plan that need something that's additional and different to what's ordinarily available in schools, but we also, our ambition really is to make sure that all children who've got special needs, who you might have their needs met locally within delegated resources within schools, have a good offer, and that's something that we're also quite passionate about, and we've developed with some schools, some Senkos and parents and carers and our Sentias teams, who are the independent advice teams service for parents and children and young people. We've developed an agreement really of what we should be ordinarily available within education settings within York. So what's the offer for all children who may have special educational needs? And that's something that we're launching at a conference that we have in November. So there's quite a lot of activity. So we're looking really across the patch, across those children with SEN support. And I think that's really important, meeting needs at the earliest opportunity, the earliest point, so that wherever possible, children don't require that additional support of an education, health and care plan, and their needs can be met at the at the earliest opportunity within the classroom as well. So
I think, yeah, and I think in response to the public participation, I think nobody says that schools are back to normal. It's important to acknowledge that they are not where they were pre-pandemic, and in many ways, I don't think they ever will be, because things have moved on. And actually what they are trying to do is establish a new normal at the moment, alongside, you know, sort of many aspects of what happens. You know, even, you know, sort of the current news at the moment shows that schools are facing ongoing challenges, which mean that they are very much having to be much more on reactive actions rather than what they could do previously, which was think more strategically over a period of time. Things got very much reset by COVID, and for certain young people, you know, they're still very highly anxious. And, you know, sort of one of the things that we are trying to hold on to is the fact that school is still a good place to be. And that's the message that we're very much trying to re-establish. And the normal for most children still is that they do go to school every day. And that's not to minimise those who are finding that difficult. But I know when Dan comes on to his report, it's very important that we hold on to the fact that, you know, still the vast majority of children in York are going to school every day. And that's despite the challenges that we've all been through, and the fact that it isn't the same as it was back in 2019, 2020. And it's important that all of us acknowledge that we're in a different place, and we're trying to work in different ways, and it is going to take time.
Just to add a couple of points really, I think Julie mentioned the education psychology team, and I think that's something that we can really celebrate in York, and the fact that we've got a very stable educational psychologist team, which is unusual, I think, nationally increasingly, for that to be in-house. And we've further invested in that team this year, recognising that the number of VHCPs continues to rise significantly. And then I think, just to mention, I think the issue of really putting the child's voice at the very centre of some of our thinking. I think over the years, we've at times brought ourselves out of trouble to a degree in terms of placing young people outside of the city, placing young people in residential schools, and that's been a national picture. I think we've learned, and there has been a national safeguarding review of the Hesley Group, which collapsed. It was a residential provision in Doncaster. That has been inspected numerous times by Ofsted. It's had social workers, parents, reviewing officers, and many other people looking into the school and going into the school, but they've found significant abuse of children going on, and that's the risk within any sort of residential institutional environment. So we need to move away from thinking that actually we can buy ourselves out of trouble by placing young people out of the city, and make sure that we invest the money that we have got in providing the best support for young people in the city. But I guess the other bit about making sure that we get the child's voice more prominent is that you will never find any 13 or 14-year-old child who will say, yes, I want to live 52 weeks away from my family in a different part of the world, sort of different part of the country. So just making sure that that voice comes across really strongly when we've got a very strong voice, both from parents and family members, that we don't miss that completely. Because we've seen and we've learned, particularly this year, that some of those environments we place children in are horrific.
If I may say, particularly for the SEND team, we're having a real focus on voice, and that's something that's really important. But also we're looking at the difference for young people who are 16 and above, because of course education, health and care plans have a range from birth to 25, and once children become young people at 16, they have choice and control around what their plan looks like, and what activities and provision would be suitable for themselves. So we're really working with our parents forum, and also with the CENTIAS, the Independent Advice Service, to really look at how we can empower young people of sort of 16 and above hopefully in partnership with their parents and carers, but it would be their choice for that sort of partnership. And so we want to really build that, that role for young people in their own decision making, and that's a real focus for us moving forwards.
Very much. Very good. And the report was excellent. I liked reading it and sending lots of questions. Questions? Who wants to go first?
Thanks, Chair. Just before I ask a question, I've had a message from Councillor Wells who gives her apologies. Unfortunately, she's not going to be able to join us this evening. So just if we could just record that. Thanks for all your contributions. There's loads of stuff in here which we could probably go on for ages and ages about, really. What I was kind of interested in, and obviously you've stressed a lot around pupil voice and the way in which that shapes both the kind of the wider SEND strategy and then also being incorporated within EHCPs and how they're drawn up. And it's really positive to hear you talking about the needs to kind of make those EHCPs as strong and robust as they can be. What I haven't got a clear sense of from both the annex and the report is how that ongoing voice is kind of fed in, because I think we tend to focus, particularly if we look at EHCPs, almost at kind of, we get to a point, we get the EHCP in place, but then actually, is it delivering what we expect it to, both in terms of, the physical day-to-day, are you getting the things that the EHCP says you should be getting, but also, over say 6 months or a year, is it delivering the outcomes that we expected it to deliver? And how is that voice fed back in through that as a, individual EHCP, but also into that wider sort of strategy in terms of whether we're getting that right or not?
Yeah, obviously, one of the formal ways that's done is through annual review. The plans are required to be reviewed annually, and as part of those annual reviews there is a requirement as well to get the young person's views, there's what we like is the creative ways increasingly that some of our schools are doing that. So they are presenting evidence where young people have put in a presentation, or if they're non-verbal, they've sent us some photographs of things that are really important to them. So there's a variety of ways that that's done. Obviously, what we've got to remember is that the delivery of the EHCPs is not done by Julie's team. So they are very reliant, obviously, on once the plan has been put in place and the provision has been agreed, that it's devolved to the education provider to actually be doing that work. And the casework team is small. I mean, there's 4 of them. So across 63 schools, can they be in there in every school, finding out in depth and detail whether that's happening? We've got to obviously be conscious of the fact that this system relies on professionals doing what they're asked to do, and we have to have within that regular briefings around what that means to those professionals. So we run regular SENCO forums, which Lynn Johns, our head of specialist teaching team, and Dan actually take the lead on with primary and secondary SENCOs, and our early years inclusion advisor does the same with our early years team. But it's important that those professionals understand that it's down to them really to put that provision in place once that plan's there. And we would expect that within just those systems around professional pride, that they're actually looking at that all the time. And part of that process of annual review is that they will make a recommendation to the local authority about whether that provision is making a difference or not, or whether the plan requires amendments. And that's one of the things that we receive from school SENCOs when they've been through that process of annual review. They'll make a recommendation back to us about this bit of the plan is working, and they'll provide evidence. But sometimes they'll come back and say, well, it's not working and we need to change an element of the plan. Don't know whether you want to say more on that.
I think that thank you. We look at voice and participation at sort of the personal plan level, which is through things like annual reviews, and assessments and having those discussions, and also discussions around with our specialist advisory team in terms of participation in adulthood and preparing for adulthood, and looking at opportunities in terms of careers and voluntary work and further and higher education. So there are lots of discussions with the children and young people, primarily at school level, you know, in preparation for reviews, but also every one of those professionals that engage in that assessment or review process have that conversation with young people as well. So we've had a piece of work over the last quarter with all of those professional advice givers, those people that contribute to an education, health and care plan by undertaking assessments, all those professionals that are already working with young people. It could be speech and language therapists, occupational therapists. You know, there's a range of partners, and we've looked at how they provide us with that advice, and we've wholly strengthened the area around voice. We've looked at what's important to children, what's important for. We've looked around those sort of Helen Sanderson principles, really, in terms of sort of celebrating what children do well, but also really listening about ambition and children's aspirations, because we want to see a golden thread within the plan of the young person or the child's aspiration, and understanding what the needs are in terms of what the barriers are for the young people achieving that, and then looking at what outcomes and provision would enable that young person to achieve, you know, their desired outcome. So we really want to see plans that have that golden thread from aspiration through to provision. And we're beginning to see that. We've had, you know, the first number of reports that are coming in with that kind of focus and that strengths-based. And we should be able to see a real qualitative difference, I think, in the plans. And that should make a huge difference, I think, to schools and settings that are implementing those plans, and for families and the young people themselves, in terms of understanding those plans and making them much more accessible and meaningful. There are some really good plans, but we've sort of acknowledged through our quality assurance that, you know, that we do need to strengthen them in terms of that aspiration and that golden thread. And we're beginning to see that in fruition at the moment. But also we're looking at how young people can sort of engage in decision making and shaping services, and, you know, how we involve young people at that sort of level, really, which is why when we're looking at the operational plan, where we're looking at a range of things that we're you know, young people are involved in terms of engagement. And Laura Brown, who's, you know, our engagement officer, she works very, you know, really well with a range of young people, you know, in different settings, really, to ensure that we have voice, but also the young people participate in that wider decision making as well. So we're looking at strengthening it at the individual and the personal, but also strengthening it in terms of shaping that service.
Thank you. It's just, you know, as a sort of follow-on, I think the bit that seems to be sort of missing from this, and it's the bit that I kind of appreciate, that we live in the real world, and resources are limited, and, you know, there's all of those sorts of issues that you know, that we face as a local authority, and that the schools face, you know, in whatever setup the schools might be. What I sort of think is potentially problematic in terms of what you're saying is the aspiration to have a really fantastic EHCP is brilliant, and of course, you know, we would all absolutely support that, but the reality in terms of whether or not a setting is able to deliver, you know, the sort of gold standard of what's within that EHCP is not necessarily always possible. You know, I totally understand that, but there are perhaps other times where actually even some reasonably basic stuff that should be deliverable isn't always being delivered, and having that annual review point is you know, obviously important, but, you know, if you're in secondary school and you're there for 5 years, you might have 4 annual review points before you leave that secondary setting. And it's just sort of looking at, you know, are there ways, it may already be happening, but, you know, are there ways in which pupils and families are able to actually say, do you know what, we've set off on this journey, I thought I was going to get this isn't being delivered, or this isn't giving me the outcome that I expected to get. And are we, I suppose, nimble enough to be able to adapt, but also, you know, very much appreciate that you're having to work with partners who, you know, I would hope that they're all playing ball, but may or may not. You may have limited levers in terms of what influence you can have, and it's just trying to understand that other side of this sort of story, I suppose.
If I can just say that an education, health and care plan contains outcomes, like longer term outcomes that a young person would need to achieve to move on to the next stage of their education. That's how it's described within the SEND Code of Practice. But it also contains arrangements for reviewing shorter term outcomes, which primarily link in with kind of termly reviews or half-termly reviews that SENCOs may manage within their own setting. So there is opportunity for more frequent review, and it's written within the Education, Health and Care Plan. But also I think that we have, you know, an open sort of door relationship with parents and carers, and if parents and carers feel that an Education, Health and Care Plan is not meeting the needs, then in the first instance they would probably, and we would advise them to have a conversation with the SENCO about how that's delivered within a setting. But also we do directly have communication with parents and carers every day. There are conversations and phone calls and, you know, and emails, and there is an independent advisory service that sits independently of us that's called SENDIAS. And they also work with parents and carers. And I have a fortnightly kind of forum with SENDIAS. So if there are any particular challenges, or then they're brought to my attention as well. But we do have, I think, you know, a quite frequent communication with parents and carers. I would say not young people. I haven't had a young person yet contact me, but that is possible.
Thank you, Chair. Just a couple of questions, and I'll start it with acknowledging the amount of work that's gone into this report and the work that's gone behind it. Recognise the work that was done from the initial inspection, and then that was recognised by the re-inspection. Questions principally start off with, there are two areas where the status is to be done. Appreciating that this is work that includes partnerships beyond your remit, Maxine. So it was just in relation to 4.1, the JSNA. So it's really, I think, from this meeting to give you some support to say, let's get that started, because that's a really important feature. And 4.5, the transition plans, which I think are they're in process.
One of the things that we needed to get in place to move forward on the transition plans is work that's been going on with adult services around the preparation for adulthood protocol. So we needed to get the protocol refreshed and rewritten to make sure that everybody was on the same page about what the transition plans need to look like, preferably from 14, but definitely from 16. And that's again a piece of work which Julie's been doing alongside colleagues in adult services. We do now have a rewritten preparation for adulthood protocol, and we have had very, very frequent meetings about what that's going to mean in terms of the work that will go on from 14 and 16, and then on to 19, where children's and adult services are working together to develop that relationship with parents and carers. Because one of the things that parents and carers find most difficult is what happens when you are beyond statutory school age. And it's an anxious time for them. Any point of transition is an anxious time for a parent. It's doubly anxious if you've got a child with additional needs, because what you're needing to understand is what happens next. And that in the past hasn't been as smooth as it could be from the age of 16 onwards, which has meant that parents and carers find it difficult to understand that things will be different if you're accessing education beyond 19, for example, that the hours actually change. Because, you know, sort of FE, the average FE package only is 3 days a week for most young people. And obviously, parents for children with SEND are used to a 5-day package of support. But part of that transition to adulthood is also getting used to what will be different as an adult. And we want to be really upfront about those transition plans so that people know what happens next and why it feels different and how they can be supported as that difference happens.
We had the Parents Forum ran a preparation for adulthood conference at the end of March. I think my second day of working for York, and it was a really fascinating and really well organised event. And I think for me, the feedback from the parents and carers that attended was communication is the real key. You know, we need to get better at communicating what those changes might be. And I think in terms of that sort of transition planning, much of that is about being kind of open and honest with parents about what the differences might be from children to adults, but also where, you know, making sure that we're planning well and we're planning with parents and carers and young people, and that's all communicated. I think what parents have told us since, you know, I've been working here, what parents have said that we do well, you know, when we do it well, we communicate really effectively and we plan strongly, but there are, you know, unfortunately cases where we haven't communicated effectively and there have been some concerns, and that's something that we're strengthening and focusing on. And the new protocol will give us all, you know, sort of an understanding of what the expectation is, what it should look like, and that's something that we'll all be working towards to ensure that parents have that communication and young people, you know what to expect. And also, if they don't have that, they know what to ask for, and that will be sort of published on our refreshed Send local offer. That will be refreshed this month, and there'll be lots of information there. So we're trying to communicate as much information on digitally as we can, but also to make sure we have those face-to-face communication opportunities as well.
And again, our Send local offer has the design has grown out of a lot of engagements with parents and carers. So it will look very, very different to the old local offer pages, because it's responded to what parents and carers have told us about accessibility and what they want.
Thank you. It was just really to get a follow-up on that, an update when all of that work is complete. I think it'd be helpful to come back here, maybe January meeting.
January is fine. Yeah.
Would that work? And it was just, I just wanted to add, delighted to see the scale up of the early talk for York included in that. That's a very strong project. And having spoken to some young people who have various support through SEND, their achievement, some are going to York College, and really delighted with the sense of maintaining that ambition throughout. So I think it would also be helpful to get an update on the internship.
Yes. Yeah.
Because I think that's demonstrating that commitment.
Yeah. And I think the other thing that's missing from this update is the work of another important team in that space, and that's our specialist learning and employment advisors. And they work exclusively with young people with education, health and care plans, around helping them to have some specialist careers advice and guidance, and you know, sort of navigating turning their ambitions about adult life into what do I need to do next to get there. And they work very, very closely with our caseworkers and adult services on that.
Okay, Councillor Nelson and Councillor Webb. But before that, in terms of coming back, we'll discuss that under the work plan, because there's various things in the report that's the optimum time to, rather than keep coming you back every. Nice to see you, but I don't suppose you come here every month.
Didn't under my papers. Just wanted to say it's really great to see the progress that's been made and that's really kind of positive. I just had a couple of questions based on the report. One of them was, I was wondering, in a kind of very easy question, when you're talking about the one-page guides, which are going to be uploaded onto the new web resource website and web pages, that sounds really brilliant. Of course, not everyone is necessarily digitally engaged or will necessarily find their way to those sites if they don't know what they're looking for. So I was wondering about whether you've considered putting those one-page guides out more widely in terms of sort of schools provisions. I'm aware, for example, Sendai is a brilliant resource in the city, but that doesn't mean that every parent with children with SEN who's struggling knows that it exists. So, you know, have we thought about how we can communicate that more widely? So nice, easy question. And I was also just wanting to ask about, it sort of mentions in here about mediations and tribunals as one of the ways that you're wanting to assess success in some of your measures, which made me just kind of want to ask about how many of those are happening at the moment, what that looks like according to kind of perhaps the national picture, how you want to bring that down, what that success will look like. Obviously, a reduction could be one, but it'd be really good to just get a scale of how many of those things are happening, how much resource they take, etc. So thank you very much.
No, thank you. Thanks for both questions. In terms of, I think it's a really good point about the fact that, you know, a lot of our communication is digital. One of the things that we've been doing with the Parent Carer Forum is getting a sense of what are the many ways in which parents want information presented to them. And very often, because time is very pressured for them, sometimes they do feel that the easiest way is something that comes in on their phone, and you know it helps them that way. But we also, when we were doing the inclusion review consultation, our colleagues in the Explores were really very, very helpful in having physical copies of some of the documents that we were wanting to share. And so thinking of, you know, all the different ways in which we can get things out to people is really important. And yes, you know, we always ask schools to repost things from the local offer at the moment. They have their own Send local offers, which they have to publish every year. But yeah, looking all the time and getting back from people, what are the best ways to communicate with you? And you know, we're very open to changing those methods of communication to make them as accessible and inclusive as we possibly can. We're also very conscious of the need to publish those guides in forms that are using things like different formats so that they become more and more accessible. We do have more accessible guides to things that use things like signs and symbols rather than just being written text. So there's all sorts of ways in which we try to make those as effective as possible. But as with anything, you know, you just got to use myriad different methods. There's no one way of getting things out there. And it's if we hear that somebody wants it in a particular form, then we'll provide it in a particular form. In terms of where we are with mediations and tribunals, historically, York was much lower than national on mediation and tribunal. In the last 18 months, we've seen more mediation and tribunal than historically we have ever had. And that's partly as well, I think, due to the fact that we're living in a context where things have definitely changed. And some of that is the legacy of COVID and things not quite getting back to normal. But Julie, do you just want to give an update on where we are at the moment?
Where we are currently, and I think we have to put it in perspective, compare it to, regionally and nationally. We're not an outlier, but there is an increase in mediations and tribunals nationally. And in fact, the courts published a report around mediations and tribunals 2 months ago and looked at, you know, those kind of escalating numbers. We always try and resolve issues wherever possible, face to face, before we need to get to that point. But what happens is every time we issue an education, health and care plan, we have to, by law, issue a letter that gives parents and carers and young people tribunal rights and explains how they can go to tribunal. So sometimes, unfortunately, it appears that parents have gone directly to that route, and we're then trying to talk to parents and negotiate and come up with an agreement at the same time. So there are a very large number of those tribunals, but we actually resolve before it ever goes to court, and we have consent orders, and potentially we would have resolved those without that need. And what we want to do really, and that's one of the reasons we're meeting with Sendias very frequently, is to try and identify where there might be some disagreements so that we can resolve those as at the earliest opportunity. And if we think in terms that we have over 1,300 education, health and care plans at the moment, within the past 12 months, we've had 17 tribunal applications from parents and carers. Majority of those we're managing to resolve without parents and carers needing to go to tribunal, because I think that's a very stressful experience for families, and it's certainly stressful for those of us within the local authority as well that have to go along to tribunal, because it is a court in those senses. So we are, wherever possible, trying to resolve those either before it goes so that they're withdrawn. We have a number of tribunals that have been withdrawn by families because we've managed to resolve those, and we've had a number of consent orders. I personally have had to attend one tribunal in the last sort of 5 months. So we're not looking at very large numbers, but we're trying to have that communication. And what we're identifying really is its communication is really important. And we've been working with our caseworkers, and we've been working with our partners to try and communicate much more effectively. So we are having a number of mediations, and they're a statutory part of that tribunal process, but we're also trying to have a number of conversations that we don't need to go to mediation. So it is an ambition to reduce those, because like everywhere in the country, unfortunately, those numbers have increased, and I don't think that benefits anybody.
Councillor Webb.
You want to, Martin, do you just want to come in on that? No, come back.
Thank you. Yeah, I just wanted to sort of state the obvious really, which is with the system was never intended for the size and scale of the HCPs that we're seeing nationally. And as a result, with what we're seeing is a nationally hugely underfunded system, and that's recognised. So I guess what we've got to do locally is work within the finances that we've got, and that doesn't always, it's not always easy to square that circle, if you like, in terms of making sure that it we can meet the expectation of parents within a system that is substantially underfunded.
Yeah, thanks for that. And actually, Bob Webb, exec member for children and young people. So my job's not so much to scrutinise, but to sort of be here to be scrutinised, I suppose. It's a strange feeling. But I think that firstly, I want to say, thanks to the work that council officers did, particularly during lockdown, when the education system was stretched in a way that it's never been stretched before. And it shows the quality of officers when, even though that was going on at the time, we were still improving. So that is really positive, and I think it's a great place to start. That's not to say that we're there yet and that there aren't more things to do. I mean, for me personally, I think the transitions is something that, I'm glad that Councillor Waller raised it, and obviously he was exec member before me, so sort of he'll remember some of this. But I think from a transitions point of view, that's one area where I think we need to focus on quite heavily. I also think social care advice as well, and those EHCPs where it matters, I think is quite important. And as everyone's said so far, I think the voice of the child needs to shine through an EHCP more, but also how does that link in with the parents? We don't want to get to a situation where we're causing friction where we don't need to. So I think that there's something there to be thought about, but that's really key. And for me, I think that the voice of Senkos So that's special educational needs and disabilities coordinators within schools, and how they feel the process works for them is something that we've maybe not heard as much of in the past, and we could do more on. So I think there's room to improve, as there always will be. But it's been a great start. And just on something that Councillor Wallace said about coming back in January with an update to some of these things, I leave it for officers and you guys to decide. I feel that could be really ambitious. And what I'd like to see is actually sort of ongoing reviews of this. I agree with Maxine that it's great that SEND was put right at the top of the list, and in our pre-meets, that was something that I certainly raised as an area for scrutiny, because it is something we need to come back to over time, to raise it up the agenda. Like I think we've raised social care up the agenda in the past. And I think just finally for me, I do think that we have to admit that there are pressures on the system like there has never been before. That's both on the education side in the schools, that is on the local authorities and our budgets. There is none of us here as councillors who can't accept that, the financial pressures that we're under now are greater than they have ever been. And that's something that we need to be aware of and work on and do what we can. But as we've all said, we will have to manage expectations if we're going to be honest and do things properly and fairly to people. I'd rather do that than completely overpromise something that would be wrong and would only make more friction. So in summary, I think that there are some fantastic pieces of work going on. We're doing some great stuff and we're moving forward, but this is not going to be something that we just go, great, brilliant, tick box, we're done. This is got to be something that we just have on our minds at all time as councillors. And we have to keep coming back to this over a much longer period than, just great, let's do it in a year and then move on and forget about it. This is going to be an ongoing conversation, because it will have peaks where it gets better and there will be problems, there'll be troughs where we need to think, right, we're going to have to deal with this. And that's the way I would like to see this progressing over time, that actually we have a drive where we're constantly looking at our SEND, and whether that's through this board directly, where we look at it on a regular basis, and it's up to you guys to decide what that is. Obviously, as exec member, I'm trying to do as much as I can to keep a view of this in the background, and obviously I work with Maxine quite closely to keep an eye on this. And it's such an important thing for the city and for this administration that we support our most vulnerable children and our most vulnerable families. And I, defy anyone to suggest that these people that we're talking about are not our most vulnerable. So let's do what we can and work together on it. And thanks for all the work that's been going on so far. Thank you.
Cool. Councillor Crawshaw.
Thanks, Chair. That's actually nicely sort of led me into what I was going to say in a way. There's a really useful bit in this report, which is just about giving some suggestions about things that we might want to do next. And one of the things that I was just sort of wondering, and I'm partly addressing this to officers and I'm partly to yourself, Councillor Webb, as the exec member, in terms of possible deep dives and that sort of thing. It seems to me like, and apologies if this is a little bit nebulous at first, we as a council adopted a social model of disability, however long ago it was. We've talked about how we remove barriers to children accessing education and those sorts of things. I would slightly disagree with you, Bob, that all of the children that are on the SEN registers are the most vulnerable in the city. A lot of them are not necessarily vulnerable, they just have needs that mainstream education doesn't always meet. And it sometimes is a bit dangerous, I think, to think of.
I think we're arguing semantics.
I'm sure we are, but I just wanted to make the point. What I'm sort of wondering is, because I noticed that there's some pilot schemes that are going to be starting around making schools more inclusive, and I think again that's something that we'd all very much welcome. It's also something that's quite easy to say, but maybe not always as easy in practice to deliver. So it seemed to me like there might be something there for Scrutiny to maybe look at and think about and see how that progresses. The other thing, which perhaps is more of a question, and again, I don't know whether this would be helpful, both from an exec member point of view and for officers or not. If the number of EHCPs are increasing, and I know that they have been over a number of years, but we seem to be kind of seeing pre-COVID and post-COVID as a bit of a turning point. And I'm always a little bit wary of, was it COVID or lockdown that created that? Was it actually a pre-existing situation that perhaps was amplified? Or, and I know, for example, with neurodiversity, there's quite a lot of stuff around children who were kind of coping and masking, and then suddenly we're in much smaller classrooms or quieter places, and then found going back overwhelming. So it perhaps was something that was there, but wasn't always, obvious. And I'm just wondering whether there are any patterns that you're noticing within the types of EHCPs that are being produced and the types of SEN that's coming through. Because my guess would be that things like, for example, sight loss would be a reasonably constant proportion of the population, whereas some of the other things, there might be spikes. And again, I'm just wondering from a Scrutiny point of view, perhaps linking in with that inclusive schools and that sort of thing, whether if there's something there around a particular increase in a particular area within the HCPs that perhaps could be supported, and it then feels like that's maybe a tangible thing that we could do, rather than just sort of look at it in that slightly higher level.
As is the case nationally, the majority of EHCPs now relate to neurodiversity, so autism, ADHD. We also have a real sort of spike around SEMH, social emotional mental health. And you're quite right, Councillor Crawshaw, that some of those sort of more traditional disabilities, we're not seeing the same sort of volume of EHCPs. So although we have seen a recent increase in visual impairments, which is just a bit of an interesting trend, that one. But yes, the vast majority of requests for statutory assessment are around children who are on the autism pathway, have communication and interaction need, and increasingly also ADHD. So one of the things that we have seen is a difference pre and post COVID is we are seeing a level of complexity that's coming through at a much younger age. And we have seen a definite shift towards more of, and you could say this is a positive, it might be early identification, but we definitely see more requests for statutory assessment coming through in early years than we saw pre-COVID. And what we're noticing is that those children and young people are presenting layered and complex need. And that's something that is a shift.
Yeah, I do think it is a strength. I mean, one of the requirements of the SEN Code of Practice is that there's an anticipatory duty for our health colleagues to notify us of babies and young children that could potentially have a special educational need when they go into formal education. And so we are identifying young children, which is very positive, and then there's additional support going into sort of the private, voluntary and independent sort of early years settings as well. It's not just into nurseries attached to schools, but into the PVI sector. So there's some support going in, and children are being supported from those early years settings into mainstream schools. That's really positive. But primarily it's around communication, interaction, and and sort of early stages of an autism assessment or a divergence.
Martin, was you answering that point? Yeah.
I think just to sort of add, I think we need to be really careful not to just see COVID as something that is a point in time that is responsible for everything, because I think it's really easy just put everything in that bucket, if you like. I think we've also got to recognise that society is changing over the last couple of decades. in the way in which within families, increasingly both parents work, increasingly technology is a way in which families cope with stress with children at times, the way families coexist in terms of eating together. All of those things I think are a combination of, particularly around speech and language. There's lots of research growing, I think, around the issue of having an iPhone and the way in which they use very young children. Children aren't in a household communicating in the same way as they would have done 3 or 4 decades ago. So I think it's really complex. And the difficulty with the brain is we're so far behind by comparison to physical health. We don't understand it as well as we think we do. It's a sort of developing science, I think.
Right, Councillor Mason, Councillor Webb, then me, and then unless there's anybody else, we'll move on.
Thanks,
So I'm
Chair.
slightly conscious. As good as this is, we're all Dan sat there thinking, is it ever going to be my turn?
I'll start from the start. So apologies for being late. I didn't finish work till 5:30, so I shuffled over here. But I was listening to Blick and everyone else on the earphones as I was walking here, so kind of got the whole meeting. Declaration of interest. Obviously, I work at a private school. I'm also the guardian of my sister-in-law who's at that school as well. So I think that's all the formalities done. I suppose, Maxine, obviously the council's a big part of this, but there is those key partners, and particularly around care and the healthcare and the integrated care board having such a huge footprint. I just wondered how that affects, Tiny York, huge North Yorkshire New Council, all the other deprived areas that sit within Humber and rural poverty and everything else. How does that affect resources, I suppose, to us? Do you feel like we get our fair share of that support, and is that working and helping us with the plan?
Obviously, one of the things that we were really pleased about during our Send Improvement journey was the way that we developed our relationship with health partners locally, and it was very much a partnership in terms of the work that we did on the written statements of action. That was CCG, sort of old money, and halfway through the ICB came in. What we do know is that there is a significant challenge around access to therapies and waiting lists around that in York. And we continue to work really strongly with the place board. And I know Martin sits on the place board and advocates very strongly around York being aware, that board being aware of the fact that there are significant issues in York which that creates, and it's important that we're not just seen as being an affluent city with no problems. In fact, in many ways, because of those things that we are seeing coming through in areas of need, we actually really do need enhanced access to occupational therapy, to speech and language therapists, and to autism assessment and to CAMS. And they're all services that are under a great deal of strain and pressure, and it does lead to parents and carers becoming very frustrated about how long waiting lists are. And it sometimes means that they, if they can, they're commissioning private assessments, which that's driven by the fact that they can't think of another way of getting what they need. And again, it's a focus of our SEN partnership board, on which our health colleagues sit, that how can we work together to look at how we can develop different ways of working, knowing that there will never be enough speech and language therapists or occupational therapists. How do we actually begin to develop ways of working in York which make the best of what we've got, but also start to look at some new ways of using those disciplines that start to make an inroad into some of those waiting lists. So a good example of that is the way that we've used a speech and language therapist within Early Talk for York. And that's been a different way of using assault. And I know that the hospital team really find that a good way of working, and being fully behind using speech and language therapists in that way. And that's what we really want to look at, how we can learn from that example and get more out of the fact that, as I say, nationally, there will never be enough of these disciplines. So it's how we can develop new ways of working as a partnership that's help us to get the most out of those professionals, but also to use them to build capacity across the system.
Thank you, Chair. I think sort of going back a bit in sort of response to Councillor Crawshaw's comments and questions, I'd say yes, straight away. I mean, I said earlier on, I think this is something we need to continue looking at over time. And from my point of view, I think scrutinising those pilots particularly seems like a sensible way forward. I think people have spoke about the change in the types of EHCPs and how that has become an increase in terms of autism, ADHD, emotional health and well-being is also a big factor in there as well. And following on from what Maxine's just said about the timeliness it takes to get a diagnosis, I would be interested in saying, well, what is there in the city to do with those those families and those young people in between? I think there might be an issue here and a full diagnosis, or I think there might be an issue here and going through quite a stressful pathway only to get to the end and find actually that's not the diagnosis that it is, and then does that person start again? And I think that there's got to be some work in supporting those families and young people on the journey, and I'd be interested in on a longer term basis if we could maybe look at a bit of that as well, but that's for you folks.
Yes, I can confirm certainly the last place board, we certainly had a conversation very similar to this around we do have, you know, the whole concept of diagnosis is a medical model of disability and not a social model. So actually, how do we work with colleagues across the health system to I guess redirect the considerable finances that go into assessments? And you know, assessment doesn't do anything different for families. It doesn't give you anything that you didn't have the day before. Much more towards a model of intervention support. And I think we could look at that across a whole range of issues from children to adults, actually, where we have much more of a social model than the sort of constant need to assess, often which just leads to knowing what you probably sort of knew anyway.
Thank you. I've got one question. I did have 17, but I'll have to keep crossing them out. And as people, what Councillor Webb said earlier, this is scrutiny of the council, not the officers. So I don't mind how this is answered, but given the fact that you're doing a great job, has the change of administration changed how you set your priorities? Or are you continuing and Councillor Webb is just supporting you? Or is it a case of you've been in the job 2 minutes and you'll have a better idea next time? It's the balance between strategy and implementation. And, you know, I just wondered if you've got any views of how you've seen it. You've accepted it's important, but, you know, this is scrutiny of the council, not the officers. So any views at this early stage?
Thanks. Yes, I think, look, I mean, I can't believe I'm saying this, Councillor Nichols, but before your time when I was on the council previously, I was the shadow version of myself now. And therefore I've worked quite closely with Maxine for 4 years. And obviously, in fact, the last public meeting I went to just before everyone went, let's have a lockdown, was on the outcome of the Ofsted report. And I sat with parents and discussed, and Maxine, and discussed this very issue. So it's one that I'm perfectly happy with the process that we're following right now. And I certainly don't want to come in after 2 years, 3 years of work on this and suddenly go, no, actually, we're going to take a totally different approach. My view on this particular issue is officers have done a very, very good job so far. I'm not saying that we are completely finished. My job here is to continue to keep an eye on it. You know, apply pressure is definitely not what I would say, because I don't think my pressure is going to be near anything compared to other people's and Ofsted's pressure and the parents and carers and young people themselves. So I don't want to change the approach because I actually think that that's been going quite well. Okay. So no, I don't, from my point of view, I don't think the change of administration should have a direct impact on how we work here. But I will follow up with what I said earlier on, that this administration's belief in supporting the most vulnerable and supporting the most vulnerable first is something that I do bring to this. And it's something that obviously will play a part in this. And our wider administration goals around tackling, the root causes of poverty, tackling issues in housing, all of these things have an effect on a family and a young person. And all these things can make life easier or harder for them. And so I think in a wider sense, our approach as an administration will hopefully help what's going on here. But no, I don't want to manage the situation. That's not part of my role. I think Maxine's got my full confidence.
Note that, Maxine, full confidence. Cool. Obviously, we know we want to come back to look at some of these things and I think from some of the answers I got in written answers, information is not going to come till next year anyway, March, June onwards. So we'll come back, but we'll talk about that under our work plans at the end. So then we'll let you know when to come back if everyone's happy with that. We're trying to move on here,
No, just super quick. I'm just wondering whether, given that we're sort of got it all fresh in our mind, is it worth, because I would like to propose that we look again at the pilot schools and potentially do a bit of a deeper dive into some of those things, around the HCP and well, my view would be that the way to do that would be, and I take officers' advice in this, presumably the pilot schools is something that's just started. So that's probably something that just needs to come back through a report in, say, 6 months or a year's time, according to how it fits with the work plan. But I wonder whether on the patterns around EHCPs, I don't know how much information is currently available and whether there would be any benefit in having a smaller task group of 2 or 3 counsellors to actually go and look a little bit in more detail, and whether, again, with the exec member input, whether that would be something that would be useful for you to have in terms of, possibly whether it's a report that comes back here or whether it's something that comes to one of your decision sessions in future. But I wouldn't want to lose that within the broader work plan discussion.
Anybody else got a view? Councillor Waller, you had a suggestion earlier. Have you got any?
Thank you. Yes, I'd ask for an update on the GSNA and the transition plans.
Yes, yeah. The JSNA obviously is supported by our colleagues in public health, and is supported by our colleagues in public health. And as you're aware, there have been some changes in public health, which mean that at the moment they're a little bit under capacity. So one of the things that we have done is we're respecting the fact that it's going to be a late start to us doing that work on the JSNA. So what we're going to do is that we are going to review the current JSNA, which we went into the last inspection on, and we'll feed that review into our colleagues in public health and then ask them to do us an update based on that. But yeah, as I say, we're just acknowledging the fact that they're a little bit under capacity at the moment to take on another big piece of work.
In that case, I don't know if you need a second, but could I kind of second the idea that we come back to the things that Councillor Crawshaw suggested at some point next year and look at how we can fit those things into the work plan, look at setting up a sort of EHCP group to look at that in a little bit more detail, and ask Maxine and council officers to let us know when a good time would be to come back to the JSNA once we've got more things to come back to.
Yeah.
And then
Have you got a general idea, Maxine, or do you want time to think about?
Can I have time to think about that, and I'll get in touch with you, Councillor Nichols, on that. Yeah, because I do want to speak to Peter Roderick before I do that.
No, just beside. Councillor Mason.
Thank you. Obviously, what Councillor Waller proposes, I think, is important. Having some tangible data, I suppose, a bit like we were saying, it's about giving you that stick to help with kind of moving things along. So I think I'd like to second that proposal around the transition plans and around having a firm date to relook at the JSNA. I think it's a key part of this document.
Do you want some time for that one as well?
I think we just said Maxine's going to let us know when a good time to look at that would be.
I will get sort of new council calls hopefully later tomorrow.
That's fine.
Just
20 minutes, I was joking.
yes. Okay.
I'll email everyone once for update, but it'll be soon. There's no point coming back at them to talk about. In terms of working group, I think we'll have to come at the end because this looks like we might have 3. I'm not sure we could support 3 groups amongst the 9 of us. All right, I'll turn myself up.
Thank you very much.
I'll got 2 minutes now. All right.
Yeah. What I'll do, if it's okay, is I'll follow the same pattern as last time. So I'll talk through the suspensions and exclusion update, and then break, and then talk through the attendance one after that, to not sort of give too much information in one go. In terms of the overall bit, just for there's been lots of debate and discussion around the terminology around pandemic. For me, this is before and after the periods of significant school closure and the 2 years that were significantly affected by them, and the sizable change in some of the data we're looking at, which follows each of those. There are a couple of news articles which we put at the front just to help members with some of the national debate. I've generally used Schools Week for that as a fairly neutral provider. The other one noted was picked from Sky, but it was just to give a flavour of the range of issues that are being which are being presented in terms of attendance as a school issue. So as stated, I won't read each and every line around some of the bits around investment. I'll start with the analysis in section 5 around permanent exclusion. And you will note that as signposted in the meeting in December, there has been a significant increase in permanent exclusions across the city. We've gone from 16 in the last academic year to 36 that were carried through, with 39 actually made, 3 rescinded. So that's a significant change in terms of the city, in terms of things being managed. It's doubled. It's historically, we've been below national averages by some way in the previous year. The new figures aren't public yet, but our local information from the networks we meet in Yorkshire and Humber is that doubling is where other people have also been. We're not out of step with the figure. We wait for the national detail to come. In terms of the pressure points for council, each of those students, if they stay in specialist settings such as our PRU, is a cost of £16,000 a year. For each year that they are within those settings. So there is a simple cost development of having 20 more of those decisions made by school settings. To mitigate that, we have, in a way that hasn't been achieved previously, had 12 of those students return to mainstream. And we also haven't had previously the same rate of rescinded permanent exclusions. So we are looking to respond to that and manage that situation. There's a huge amount of work that goes into that. The DFE guidance allows head teachers a legal right to use permanent exclusion as a sanction. So there isn't a legal or statutory reason why I couldn't perhaps be with 10 tomorrow. So to limit it to 39 across the city of 60 schools is huge work done by schools, huge partnership created by all the teams within the council, and a huge ongoing discussion around the culture and the way that our school settings work. I've then done an analysis of the primary phase. This is just particularly useful to see where our pressure points are across wards for different areas. In terms of the primary clusters, there's a fair question just raised in advance around the number of schools in each cluster. I've just adapted the answer I've just gave previously to that because I've included the secondaries. So there's 10 in West, North East and South Bank in terms of schools. 8 in South, 7 in East and 6 in North. In terms of the analysis of this data, the one thing to bear in mind, apart from the fact that we have had some permanent exclusions at primary phase for the first time, is that they're very spiky figures. So 39 of our primaries, which is a number around about 50, have had less than 10 suspensions during the year, and 32 have had less than 5. Whereas in comparison, one of our primaries has had 32 suspensions. So there is variety within those figures, as well as me reporting across the different areas. In terms of our secondary phase, you'll see we're on a steep rise. We've just about doubled around our suspensions in line with the permanent exclusions. We have been, in terms of last year, when those the figures supported, we were below Yorkshire and Humber averages, but we were above the national picture already for suspensions. So we wait to see if that remains the case. At times, schools would cite that they're using them to manage the risk of permanent exclusion, but it's a balance, and we know that students being suspended from school means students not being seen for that period of time. So in terms of the key messages, we do have an increase that is being seen nationally. There is financial risk to that, as well as individual student and family risk. And that's something which I think it's appropriate to bring through to council. And there are profiles within that link into the actions around a particular predominance of the west areas of the city holding a number of those permanent exclusion decisions being made. So there's actions. Again, I won't read each of them. I just wanted to pick from the list that we have been on a 3-year piece of work alongside support centre at York High School, which they previously called STAR, and is evolving within their setting. That has led to a reduction, and there is commitment to significantly reduce that in the next academic year. So that's been a real citywide approach, looking at the figures that were there. That was part of the work that was reflected in the York High Ofsted, and then moving to a good school. We also have got support from health linking in with the JSNA discussions. So the Wellbeing in Mind teams, which is government and NHS funded mental health support teams, have been working in the north and west of the city, partly through this data. And we've been successful in a competitive bid for getting a second team who are going to be working in the east and northeast of the city as well. So that's a significant success for us. We have created an alternative provision directory that didn't exist 4 years ago, with over 20 local providers who work to support students who are struggling with behaviour or attendance grounds. And there's 99 students who are benefiting from that, whilst remaining on the mainstream school roll, 78 at secondary level and 21 at primary. That's funded by schools and has reduced the risk of our higher needs fund spending by using schools' own resource to commission beneficial additional placements for those children. In terms of the final bits which I wanted to raise on the suspension bits before a break for discussion on those, is ongoing work with York College to both provide placements to students who are electively home educated to return to a mainstream education prior to 16, and also some targeted use for our mainstream schools to be able to use that creatively and appropriately for students at risk in year 11. What I would say is that during the year there was quick fleet of foot impact of our work with the schools and our collaborative work across school settings and the council. We had 9 in the first half term and managed to reduce that significantly by being open about the challenges that presented, and by being clear about the mechanisms that we would need to put in play. And we've just heard a lot around the HCP, the SEN support area that we work through as well in that field. In terms of Danesgate, which the council has invested heavily in, the students who are supported without EHCP have reduced considerably there, from around about 180 in the first year of right role to underneath 50 at the start of this year. So schools are maintaining a lot of those students in their mainstream settings, and that has allowed us to provide more support to EHCP. So we can't detach our systems. If we have more students out of settings without EHCP, then it makes it harder to support the numbers that we would like to with. So I see that as a huge strength of our work in terms of the areas that we've looked to work within. And I think it's been about managing impact as well. A lot of my colleagues in neighbouring authorities have run out of provision despite that doubling, we have managed to work within our existing provision and within our providers. That will remain an ongoing anxiety and an ongoing communication that we have with our school settings. But we've got incredibly functional school meeting panels. We've got incredibly understanding in terms of their understanding of the challenges, school settings, and we've got some very talented officers as well working with what is a significant increase in need.
Okay. Questions? Councillor Webb was first up.
Yeah, thanks. I just wanted to come in on the back of that and thank Dan for all of the work that goes into this, because this is not an easy process. And I think on behaviour and attendance first, I mean, let's again be quite honest, poverty is biting, and young people's and their families' lives are probably harder now than they have been in a long time, and that will certainly impact the behaviours that are seen in schools, and that will be something that we should consider. And I've been really pleased that, you know, schools have been developing adaptive teaching models to make the school a more positive experience. And I just wanted to start off by saying that from my point of view, I am arranging meetings with the various CEOs of the trusts. And I will want to make it quite clear that I want to see positive work from them on how they can make their school an inclusive environment, and how that they can support their teachers and their young people to really sort of work together to make sure that we do have young people in schools and it is an inclusive environment. I think it is worth highlighting that it's a concern that we've got young people who receive free school meals and young people with SEND who are disproportionately affected by this in comparison to those that are not. And that is a sign that we've not got everything right. And I don't think any school ever will get everything right. I don't think any local authority ever will, but it would be wrong to not highlight the positive work going on in schools and in this authority to really do what we can to support young people and make it an inclusive environment. So yes, so that's where I wanted to say on behaviour and attendance, and I'll come back later on the other part of the report at that point, if that's okay. Cool.
Thank you, Chair. Thank you very much for putting all this together. And I think that just something that I wanted to kind of ask you about was reading this report. It almost seemed to me that in some ways the national figures don't really work as a benchmark when we're talking about the city, because we are such a city of opposites, and all you have to do is look at the kind of all of the West Cluster data, and equally all of the free school meals data, as well as the SEN. But I think for me, free school meals receiving pupils, the data on them that is within this report is really quite outstanding and concerning and shocking. To see that in some ways, clearly we have areas of the city where that would be so far from the national average if you took them just based on those specific area datas. You know, obviously just looking at 88 suspensions in the primary phase in 12 schools in the West Cluster, and the closest sort of school cluster with 12 schools, is 35. I mean, so I suppose what I really wanted to ask is, how are we approaching this hugely disparate kind of level of need and working to support the families that need it most? I also just kind of, as part of that, wanted to ask whether schools themselves have attendance officers or family officers working within schools, or whether, you know, how much of it is happening in schools, how much of it's happening through City of York Council. Thank you.
Taking the last point first, there's all schools have got a pastoral team of some description. They can vary. When we talk about the attendance as the second part of the data, one bit of our work has been really establishing who is the key contact for attendance in the school. So there has been a significant increase in those, we've got somebody who's purely on that attendance brief. But that's something which is a school decision to make, and the DfE guidance isn't completely statutory as yet, are those expected to become so. Often it's a shared role for somebody pastorally. In terms of the different areas of need, we're really aware of them. We collect that data in either monthly for the secondaries or half-termly for the primaries points, and it's where we've targeted our work. It was the places where we've put the mental health support teams. It was the places where we've invested in extra provisions, and it's where we've particularly looked to link in with those school settings on a range of matters. There's particular bits on attendance, on suspension, around certain particular areas of need. So we know we've got a spiky profile. Our first job is to know where those spikes are, and our second job is to be able to support those settings appropriately.
Can I just follow up on that? With that being the case, what more do you need? I mean, obviously everyone needs, like, everyone is in dire financial straits and there isn't enough provision, but are there any kind of specific barriers or specific areas that you would say are standing out as, actually we need more of this or that?
Yeah, it's as you say, it's everyone could always need more time. I think you've got a small team now in education within the local authority, and that because of that we do a number of roles. So there's as there is a change of presentation. For example, each of those permanent exclusions needs a legal meeting, potentially a second hearing with an independent panel, and needs a family prepared for that, a local authority attendee, and then the outcome to be resolved. So there's been more of a doubling of that process, which comes from my role, etc. as well. So in terms of the ability to be both strategic and reactive, I think that's always your challenge. And in terms of people who can work directly with a school, staying ahead of that whilst you're also working with the other aspects of it, that's a particular challenge. I think in terms of the other bit which I've referenced within the report, is that we do see a need, and this is the debate which we've had over the summer with Martin as well, around working particularly with families that we can see are represented heavily within our data. We've got a very low amount of provision remaining for students of high need. So if we can help a family who might be presenting in 4 or 5 different ways in that data, then if we can get ahead of those situations and support those in a credible way, then we stop that dominating the use of the resource we have remaining. So I think it would be, for me, always human resource, but I know that's the hardest thing to achieve.
Sorry, thanks. Just a quick extra one, just around. So we've sort of mentioned a little bit around potentially free school meal being overrepresented in the suspension data, and I presume that the reason we haven't got that data within the report here, because obviously the attendance is broken down by various different areas, is because presumably the numbers would be small enough to potentially be identifiable by individuals, those sorts of things. I just wanted to be reassured that when we're looking at the suspension data, we're looking at it in quite a level of detail to sort of understand if there are those clear patterns going on, and you know, that sort of thing. I wouldn't necessarily expect it to be put into a public forum, but it's just the reassurance of that. And then just sort of wanted to understand, slightly harking back to the conversation that we've had around EHCPs and pupil voice and that kind of understanding. I'm just wondering if anything is done where there are, you know, outlier schools or outlier areas with a lot of suspension going on. Are we actually going and having a conversation, not just with the families, but with the young people, about saying, well, what is it about this school environment, or taking the points that have been made about a broader community environment, perhaps? Because, you know, there is no one magic fix at all. But I think sometimes, particularly in secondary school, actually young people are able to articulate quite well what it is that they need that they're not getting, that means that they don't want to be in school, or that they're acting out in school, or whatever it might be. So just on those 2 points, if there's anything you could add.
On the first one, we do hold the data, but it isn't within the report, in terms of the detail within things. In terms of the second point, yeah, we're looking to increase that voice again. It's reaching it, as we said, in terms of challenge. We've run a lot of our in-school support through the Learning Support Hub, and the Learning Support Hub is where cases of challenge can be raised by families. We've got student voice captured at the front end of that, which we feel was in the first year of its existence is a bit more limited than we'd like. And we haven't as yet got the student voice at the end of things. So that is definitely an area for us to work through. Where there have been particular interventions such as the Star Centre at York High with the cohorts there's been a lot of individual cohort-led work done with the school wellbeing service who are attached to that pilot, and a lot of detail sort of drawn through from that. I think the bit which comes back from that is then achieving that within provisions. If what comes back from that is around small groups and flexible days, it's about when schools can move to that and find what size of cohort, and if it can't be done by the school, what we can achieve and when we should, as the themes that come through.
Yeah, just on that point, I think, so I attended Show Me That I Matter board, which is a group that works with children in care. And I think to break the ice, one of the officers mentioned that I was a teacher. And so, yeah, basically I heard it all about the issues that they found in schools and things like that. And I actually found it really, really valuable. And so I just sort of support Councillor Crawshaw's point there. And I think that, Dan, that's something to take away and sort of do what we can to work on, but around pupil voice, and particularly around the benefits of any alternative provisions that we are putting together. I think that'd be really helpful just to sort of dispel some of the myths, but also sort of work out what it is that works and makes it work for young people. So yeah, I think that's a really valuable idea.
Part two.
And I would completely acknowledge that in terms of an area we want to reach. In terms of the report on attendance, there's different elements of this. There's some really good news coming through at primary, which is pleasing because it's been a significant area of focus this year. So we've got an improving trend in absence rates in all areas and vulnerable groups for primary school attendance, and we're below national average for the majority of places. There's a theme that we've been talking through all night, that our groups which are slightly outside is SEN cases with EHCP, and more significantly outside is those students who are in receipt of free school meals. So that, other than that, the primary picture for absence is improving, and we hope that feeds through. There's a notable improvement in children in care's absence rates, that is worthy of note, and we hope that this is something that will feed through to secondary in terms of the timelines of cohorts as they recover. There's a similar picture in terms of persistent absence. So those are students who are below 90%. So you will see that the primary data, that those are again favourable comparisons to national, and that is something which we're really positive about. Apologies, it's put me to the top of my document. So from memory briefly, you'll see a different picture in secondary, and in terms of secondary, there is a significant decrease. Thank you, Maxine. Sorry, I'll finish going through the analysis here. So persistent absence, we're really pleased with primary, significantly better than last year. The primary school persistent absence analysis, I can hear I've sort of got people turning pages, apologies, computer glitch there. And you can see that again, for all areas, including those more vulnerable ones, a free school meal and SEN the HCP, we are below the national average for the absence levels for those cohorts. So that's really quite significant. That means that the students below 90% are performing better in York against those measures than there are in the national picture. In terms of the severe absence is a government definition now. So that is those who are below 50%. We can see we've got quite a stuck cohort of primary, around about 65-ish, just over before, just under now. And that is a population which we absolutely want to understand more and to draw more from. That is a group which we think are significantly also highlighted in our overall attendance figures, because of the effect that a number of very low attenders can have on the overall percentages for our population within the city. In terms of the analysis, we have done analysis of their characteristics as a preliminary to doing more individual work, but we can see that those students who are severely absent, there is an overrepresentation of students in receipt of free school meals. There are high percentages for those who are either on SEN support or with an EHCP for their SEN. There is a higher number, particularly at primary, of students with an autism diagnosis being reported by schools. So that overlaps with some of the first discussion that we had, but there's a clear element of the presentation of those who are severely absent in our primary settings. There is good debate and good interaction, really strong multi-agency interaction around the students with social care. You can see 70% of those don't have a social care involvement currently. We've done a lot of work. We formed an action group between education, social care and health, and I presented at Social Care's annual conference last year and provided a handout around frontline workers' support of attendance cases within schools. And I think it'll always be a good healthy tension around when social care involvement is appropriate for an attendance case and when it's an early help or a school-based matter to resolve. In terms of secondary, there's less positives in terms of the secondary data. We are below national for all students, and we are particularly below national for SEN students and for those in receipt of free school meals. The situation gets more interesting when we look at the persistent absence table. So those students who are below 90%, we're better than last year and we're better than national. So our analysis of that, which I think from linking in with the research school as well, absolutely stands water, is we've got some very low cases of attendance bringing down the whole student number, and our persistent absence figure is actually holding up okay for all students. What we're not hiding from whatsoever is we still have got above the national average for persistent absence for EHCP and SEN support. And there is a really stark figure around those students in free school meals. If you're in receipt of a free school meal in York of secondary age, then over half are persistently absent. And that's a call to arms that will be repeated at our attendance summit next week, and something that the schools are acutely aware of as a barrier around the attendance of those students. But we also know that overlaps heavily with our concerns for the outcomes of those students, whether that be academic or other. In terms of severe absence, we've made some inroads, but we're carrying a high number of severely absent students at secondary, to over 250. And again, we've done a similar analysis that shows a predominance of free school meals, SEN support, markedly more than the HCP, which is interesting in terms of the different cohorts. A similar number without current social care involvement, and a smaller percentage with an autism diagnosis acknowledged by the school, but a similar raw number in terms of what provides the overall figure. So we know that there is an age heavy from the national analysis number of severely absent students in the older years who have had a particular detachment from those 2 years of school closures, and it may be linked to that, but we have to hold a responsibility to engage those students now and to keep them well focused in schools' minds and our own. I know that the government advice is clear around the duty of local authorities to look at enforcement routes as well, and I know that will be a debate in an area of interest for council. So I wanted to offer reassurance as those grow, that our use of those for persistent absence is intelligent, well below national average, 6.6% of our fixed penalties compared to 15%. Nationally, and is only acted upon after the school have provided evidence to the local authority of a graduated response that either has not been engaged with or has not been sufficient despite best efforts to mitigate. And it wouldn't be put in place if there was something which would be an obvious barrier to that attendance. So in terms of that, some detail there. We have increased our response to leave of absence, which I would recommend to members where that's been for a holiday within the school time. That is something which we feel is an area that we want to encourage. And you can see that our overall rate, despite the fact that that's very much dominated by leave of absence responses, is in line with Yorkshire and Humber. But I think the percentages at the top of the 6.6 against the 15 is the strongest part of that analysis of the intelligence and the proportionate responses that we're doing around that. So I've talked through most of the key messages, the difference between primary and secondary, and the distances around severe and persistent absence. There's lots of detail around the actions taken to date, which covers some of the work that I've covered as well. The schools paid for an extension of the council team, as the government's guidance talks about an attendance team, and we had the single attendance advisor, Mark Smith. I've become more heavily involved, and the schools provided funding for us to appoint a school attendance lead and a attendance enforcement and data officer. Both of those roles have been really, really valuable to us being able to achieve the success that we have in terms of improving primary attendance and some areas of secondary. I would not be able to present to you as coherently as this without somebody continually on the daily live information that comes from the DFE. Some people will come to you and present on data that changes every month. Mine changes every half day. And is across all 20,000 of the students in the city. So to be able to be strategic with that requires somebody who can do the analysis that leads a lot of our work. And also has been an important part of us being able to honour the times where we have used the enforcement route. The school attendance lead role allows us to meet the DFE requirement of a termly meeting with every school to have a check and balance whether that school are doing the things that we are saying centrally. And the most innovative and exciting part of our work has been that person has taken an early help approach to emerging areas of school attendance need. So that post holder works with cases where the attendance is between 70 and 85%. They've worked with 28 cases, which compares well to the general early help case where we work with 14, and 74% of those have seen an increase. The areas that they've been able to expose through that early help work have been very much around areas beyond the school, but around areas that can be met through early help. So we're really pleased with that work. We would like to now be able to sort of lead that through with other school settings, and the purpose that was to model it to schools so they would see it, value its worth, and replicate it in their own early help work where appropriate. It's given us a lot of multi-agency learning as well, and is a big part of the attendance summit on Tuesday of next week. In terms of other bits I just wanted to draw through we've heard Johnny make reference to alternative provision and also Councillor Webb as well. But the schools do cite that over 40% of the severely absent cases have been engaged with a form of alternative provision from our directory. The last bits that I wanted to pull through, I've talked about the training for social care and the attendance action group that's been formed. We are linking in with Raise York and the Family Hubs agenda to see where the signposting, the support for families can be linked together here. There's significant members of the attendance action group who are on that board looking for areas to link in. And we are working in a targeted way with schools in the west and north of the city, particularly the two large secondary schools, because of needs that come from previous data sources, and there has been a significant reduction in those needs around the students who are severely absent in those settings. I think the final bit to say is that we do find ourselves underneath that termly scrutiny. We have a DFE advisor every week, and they have described our work as being in the top quartile. So given there, although we're not completely beholden to that, the fact that they get a helicopter view of numerous local authorities, we'll take that positive feedback. In terms of the section around 14 and options, we know that this isn't a budget meeting. But there is risks to some of the success we've had because the attendance posts were funded for 1 year by schools. We have managed to support the extension of the attendance enforcement and data officer by 12 months within available funding. They ran November to November. The school attendance lead post runs January to January. And in terms of the post holders' impact with the early help work and with their termly meetings to keep 60 schools on message and using the right tools that we would see evidence of working with the city, we are looking at ways of how that post can be maintained. And the only other bullet point beneath that, around that, is again we have some families who are really represented in that data, who we see benefit in looking at a youth work model or more intensive way of supporting to prevent them being in a stuck situation. So headlines will be significant improvement in primary, which we really hope is going to flow through. Secondary, some areas improvement, some areas of real concern, and significant innovation and work within the council that has been to this point significantly funded by the schools.
Yeah, just to add, and I think that's a brilliant report, Dan, thank you. I think it's really important that we go back to page 39, and particularly the report around the ghost children. There is no single reason for the surge nationally in school attendance. We can't treat children who aren't attending school as an homogenous group. They're not. And there's lots of different reasons. I think if we take one approach, whether that's a soft or hard approach or something in the middle, then we will miss children out in terms of making sure we get it right. So I think we need a multiple, lots of different approaches, multiple prong, thank you, approach to make sure that we deal with this issue. Everybody will know, I'm sure, particularly you as councillors, when you're talking to families and others on the doorstep, you will know of individual cases of children that aren't attending school, but we can't assume that's why everybody else isn't attending. So, you know, whether we're using fines or other particular approaches, it's really important that we don't assume that we shouldn't use one or the other. And I think that national work, particularly around that research, is very much evidence of that.
Councillor Webb and then Councillor Waller.
Thanks, Chair. Earlier on, you asked me if there was any difference because of a change of administration. And what I'd say straight away is I don't think there's a difference because of the change of administration, but what there is learning to take from last year around attendance. And I'm making particular reference to the use in schools of if your attendance is below a certain amount, this can have this sort of impact on your education. If it's below that sort of number, it can have that. So I personally don't find that particularly helpful because often, you know, that's a thing that's in a school and the people we're trying to talk to aren't in the school, they're not attending, that's the point. So that's something that I do think we need to be much more multi-pronged about. We need to look at what works for different people, okay? And I think that I'm really looking forward to this attendance summit that's coming up next week, because I really do think that we can look at lessons learned from last year and look at how we can change our approach. We need to genuinely recognise the genuine needs for individuals' attendance. There will be all sorts of reasons why young people are and are not attending, but we need to remind young people of all the positives that go on in schools and do everything we can to make schools a positive experience and really, you know, work hard in partnership with schools to sort of promote that positivity and promote the benefits of schooling. And for some young people, they do struggle to see the benefits of education and they do struggle to see what's in it for them. We need to look at we do need to work with our schools and sort of really promote what we can to look at that curriculum model where possible within the constraints that we find ourselves from the DFE. So these are things where I just think that it's certainly not a change of approach, but it's an evolution from what we had last year. And I think, you know, I'll finish on this word severe, which is a word that I've not heard in this context before, if I'm honest. And that really does sum up certain members of the government's viewpoint on this, which I think is really, really unhelpful. We need to be working together on getting our young people in York into schools. And I think using that term is challenging. It's not something that I think that I'm glad Dan, that you explained that it's a government term and it's not us. And I think that that's something that we need to think about, that we shouldn't be looking at this is a severe thing. We should be thinking, how can we help young people back in schools? So it is a tough one to get right. And I do agree that I think we need to look at this in lots of different ways. And I'm really, really hopeful that over the next year, we're going to see some improvements in these numbers, and we're certainly going to see a change in approach to just make it more inclusive of different approaches where we can. So yeah, I'm really happy with the work that council officers and schools have put in, and let's just keep going and learn from what we've done, learn from what we've not done, and keep working together with schools. Thank you.
Councillor Waller, then Councillor Mason.
Thank you, Chair. I think building on previous comments, I think understanding the different causes for absence, because there isn't a uniform reason why. And I think as a school governor, that's something that all governing bodies must be going through that, because whilst nationally there isn't a clear picture yet, I think it's important that we do the work locally, because we know our areas best, and the schools are certainly doing a lot of that work themselves. I think in terms of the interdisciplinary support for schools, it's something that I felt very strongly that pastoral teams need to be able to signpost where there is a specific need, whatever that need is, and for the council corporately to respond to that, and for partners beyond that to play their role in enabling young people to attend and feel that they are being supported, and that families are being supported, because many of the problems are brought in from outside, and solving the root of those is an important feature. In terms of the early help role, I can see that evidence, and that is important, and I think it's essential from the options that you've put in paragraph 13, that the resources are made available to keep that post running, and I would implore Councillor Webb to enable that, so that there isn't a cliff edge, and that a longer term view can be taken during the budget process. Thank you.
Well, I'll say, Nathan, I'll let Councillor Webb answer that question.
Yeah, I'll just come back very briefly on that. I think what I would say on the options is we need to work in partnership with our schools. Of course, we will do what we can as local authority, but what we can do with very limited budgets is quite tricky. And as Dan alluded to throughout that report, that I think, you know, support from our school system in partnerships really, really key. So yeah, happy to look at this, happy to work on this, but as Councillor Waller, you'll know, the budget is stretched further than it's ever been stretched. And so what we need to do is work in partnership and see what can be delivered. And I'm happy to have conversations with Dan outside of this meeting about, you know, what would work, what wouldn't work, and what we can do.
Councillor Mason.
Thanks. I was interested in the EHCP children, I'd say children, I suppose, in general, but particularly obviously following on what we've talked about in the last couple of hours. How does that kind of get fed back through then? Because there's significant rates, and you would think these are the kids that are getting the most support out of most children in school. How does this all fit into that kind of annual cycle of review, and is it picked up, and how long does it continue for before, you know, is it something that actually these figures are kind of a yearly thing, it gets better than the next lot, and it kind of just has that cycle, or yeah?
Yeah, we've got a particular focus at the moment on those young people who they're unable to attend school. I'm not saying that they're finding it, that they're making a conscious choice not to go to school. We've got a number of young people who've experienced autistic burnout, and they are being supported by our specialist teaching teams, who actually they're medically unfit for school, as some of these young people. And one of the things that I've asked that team to do is very much focus on the voice of those young people and what has led to their crisis and their experience, because we need to understand that more closely, to again think about those early triggers, and our school colleagues cited on when those early triggers are occurring. We have one of our EPs, one of our senior EPs, who's been doing some work in this space around what are those things that families can spot as early indications that something is going wrong, and also how that can also help all professionals to be more attuned to some of those triggers. And again, that's a piece of work that we'll be looking at through that attendance summit. As we've said, this is multifaceted, and everybody who's in these groups of not attending school will have a very, very different and personal reason for not being there. We're working an awful lot around those young people who at the moment don't feel that they can be educated in a school, and they're represented within some of our young people with an education, health and care plan. And their education at the minute is looking highly personalised, isn't it, Julie? And some of it you would say is not what you would describe as traditional education, but it is about trying to support them to get themselves re-engaged with some form of learning, because they've hit that point where the thought of going back into a classroom in a school is something that they just can't do. Despite a number of different professionals working with them. So it's I think locally what we've got to know is all of those different triggers. Are we really under why some of our young people who live in disadvantage find it difficult to go to school? I think, you know, anecdotally, there's a lot of information, but I don't think we've got enough of that real getting under. What is it that's meant that you can't get yourself engaged with school? It was interesting because I met with a young man in another local authority a few weeks ago, where he was talking about his experience of not being able to go to school, and it was actually because of bullying, and he'd got completely disengaged from school because of that, and couldn't see that he would be safe going back, despite the fact that the school was offering reassurance and saying, you know, certain things would happen. So that, you know, as we've been saying, this is as individual and personalised. Each one of these young people who's struggling to have good attendance at school has got a particular story, and it's how we get at that as a city, which is the real detailed work that we need to do.
Thank you. I think a really important thing you said there was about the, you know, non-traditional education and giving those different options for people that, you know, school doesn't work or it's not the right thing. I had a kid who was probably one of those in terms of not attending, and, you know, by the end of it, he won Apprentice of the Year or something. And, you know, I think it just showed by giving him the right focus, it gave him the right outcome. And you were chatting about transitioning things earlier and how you move up life. Then I think that should be a really key focus. My other thing, Chair, apologies, I'll be going at 8. I only allocated 2.5 hours, I'm afraid, for tonight.
Councillor Gilbertson.
Yeah, thank you, Chair. Thank you, Dan, for your report, and also Julie and Maxine for yours. It's good to see in Dan's report that there are some things which we're managing to improve and get a grip of. It was particularly important to identify those problem areas that Maxine's just been describing, where young people feel disengaged, and we can't put it down to a concrete symptom, pardon me. But it just turns out that bullying or something like that was very effective at making them disengaged. I've got 2 or 3 questions. First of all, an explanation, and if it needs to be done separately, I'll be grateful. The comment about graduated attendance response. So it's a new expression to me, and if we've got some easy description of it, I'll be happy to have that by email, unless other members need some words about it. Secondly, it was good to know that the attendance team produced some evidence which helped support the bid for a new mental health support team in the East and North East. Could you say a few words about how that team will be constituted and when it will be in action, please? And another thing is I want to welcome the post-16 pathway at York College. So I think that is actually a significant factor in helping young people with special needs see that they are actually part of the mainstream world. And that's quite a significant, you can see young people, they have a spring in their step when they're going to college. There was another point, and if while you're talking, I can think about it, I'll come back with it if I may. Thank you, Chair.
Thanks, Ian. Just to reflect the last points to be made by councillors, I think it does reflect the multifaceted nature of the challenge that there. It's worth reflecting that the DFE advisor in our last meeting says that the whole system is trying to pick the best routes forward, because this is so new in terms of being 1 year of quite a different presentation. So we're really keen to have that broad approach. That leads us probably into the graduated attendance response, Ian. So if you're at the summit on Tuesday, those of you are, I will talk through that. But it is a filter document that we expect all of our schools to work through, which ensures that they consider each and every one of the barriers that there may be to low school attendance. So whether that is through an SEN lens, whether it's through a lens with support from CAMS, whether it's through an early help lens, whether it's through more simple adaptations of the school provision or day, then schools have to work through that as a way of considering what support can be offered to each and every setting. So it's a York developed document that's been created by the team and is utilised by all of our settings. In terms of the mental health support team bid, so that's it's a set government and NHS model. It's a team of 7 who will support up to 8,000 schools, 8,000 school children in that area of the city. That's probably about the resource allocation that normally comes through, isn't it? It didn't sound as disbelievable as it should. But the 8,000 children within the east and north east of the city, so they're supporting both of the secondary schools, Joseph Rowntree and Huntington, and primary schools feeders into those who have put themselves forward to be part of the project. So that will be direct working with students in school, and critically some who are at home, to look at those where there is a barrier to any kind of achievement in school, whether that's attendance or other matters.
If you don't mind me asking the follow-up question, I have remembered it now. It's on the middle of page 50 about the significance of young people who are electively educated at home and working with them, and it seems slightly inconsistent, the impact on the overall absence rate being linked to that. I wonder if you could explain that point, please.
I think in terms of the link to elective home education, there are sometimes a family will choose elective home educated after a period of long absence. So there is a clear link there in terms of that figure can increase if we've got more attendance risk. We're open and honest with our elective home education community that there is personal choice within that, and it will be something that may be right for some, but we want it to be something that we in close dialogue and can support that decision making and how that changes over time.
Incidentally to that, does that mean then that there's a rising number of young people electively educated at home, or educated otherwise, or whatever?
Yeah, so this is when parents take full responsibility and they can indicate their legal choice to do so at any point. We then work within the statutory legislation around the supervision of that. We have seen an increase, so we are well below the overall national numbers, but our increase is around about 50 to 60% in terms of those figures.
I see. Thank you very much. Thank you, Chair.
Thanks, Chair. couple of very quick points and some questions. Just on some of the analysis that you were talking about the need for the kind of individual narrative and you know, people having very different experiences and stuff. I was just reminded of the Human Rights and Equalities Board did a piece of work around not in education, employment and training, probably 3-4 years ago. And then it sort of kind of got parked a bit. And I think that was quite a significant piece of work, which it might be worth just feeding back in again, and particularly if there's, you know, a greater emphasis around attendance and reasons for why. I remember in particular, I don't think they drew very many themes, but one of them was things like having to wear shoes at school and, you know, just quite simple things. The attendance summit next week, which has been mentioned a couple of times. First of all, I wasn't aware of it until I read the papers. I'm not sure whether it's an internal or an external thing. I just wanted to make sure that there was an opportunity for young people to have a voice at an attendance summit. On that, there's just a very specific point. Sorry, I'm just going to rattle them off because of the time. Page 45. One of the things within the data set of severely absent pupils is no CSC, and I can't for the life of me think what that CSC stands for. Whether it's a typo or not, I don't know. Children in social care. Right, thank you very much. We're trying to go through and think what it was. And then just on the broader, slightly broader substantive, which goes back to the data analysis and the point you were making, Dan, about, you know, very live data and also the need to be really smart with that data and all of that sort of thing. And I was conscious of a couple of things. One was persistent absence being such a kind of blunt threshold in a way that, you know, a child that's attending 89.9% of the time is not the same as a child that's attending 74.whatever% of the time. And if we do return to this, what I would be interested in seeing is a bit more of a detailed breakdown in terms of like quartiles, or, you know, but something that kind of gives us a bit more of a steer on, actually, are most of the kids in the city getting there for nearly over the 90% threshold, or have we got loads of kids that are just teetering above the 50% threshold? And, you know, that obviously has a big difference in terms of how we approach things. And likewise, just with those kind of big overall figures, and I assume the figures that you sent me are okay to say, yeah. So I was asking about what the disparity or what the range was in terms of the average attendance and the average persistent absence within the secondary schools. And I expected there to be a bit of a variance, but actually it's enormous. The lowest 23.6% persistent absence, the highest 50.9%, more than double. And actually what stood out to me was the lowest figures on both the overall attendance and the persistent absence were not that much below the average figure, which suggests to me it's a small, we've only got 8 or 9 secondary schools, so presumably it's 1 or 2 secondary schools that are quite significant outliers. And it's just, again, wanting to be reassured that A, we're working as closely as we possibly can with those secondary schools to make sure they're being supported. B, I guess that there will be some common issues or some themes that might give us an opportunity to kind of help and support as well. And again, just thinking about future data coming forward, for me, it was really helpful to understand the figures just to see what the range of variation is, because I think it tells you something about what the actual problems might be. You know, if you've got an overall attendance rate of just, you know, whatever it is, 90-something% average attendance rate, but you've got one school that's got 83% attendance, I'm assuming it's one if that's the highest number, you know, that says to me we need to focus there, and it's just understanding that from our perspective, I think it's really helpful.
Immediately say, Councillor Crawshaw, that stratification I think is really helpful, and something which we'll do on the next scrutiny round. I think it's a really helpful suggestion. In terms of are we getting to places where we absolutely are. That's the 2 schools that have been prioritised in terms of the work on severely absent students, and the educational psychology training that Maxine referred to. Has been particularly with the trust that operates with one of those schools. So it is part of our knowledge and work.
Yes, yeah, just also as well, obviously there's another particular project that's been seen by councillors in that area, which has got over £2.5 million worth of investment in connection with the university. So there's a lot of other things happening as well that will take some time. We'd expect to see some improvements.
Thank you. Just actually following on from Councillor Cuthbertson's questions about families who are electively home educating their children. I just wanted to kind of ask, so I know that I'm aware of families in my ward who have almost felt forced to take that step because of, you know, struggles that their children had, as you were kind of talking about, both of you. Every child who is one of these statistics has their own story, has their own struggles, as does the family. And I'm aware of a number of cases where families have decided that home educating their children is the best thing for their child, but obviously it puts a significant stress on often working parents to then kind of balance that. I know this isn't the case for in any way all home educators, but I'm aware that there are, I would imagine, rising numbers of families who find themselves in that kind of situation in the city. So I just had a really quick question about, I suppose an area of concern is that once those families have taken their children out of school, they are no longer represented in these figures, and there is a kind of real danger of them falling through the gaps of the other support that the council should and can offer to those families in the circumstances they find themselves in. So what do we do kind of in those situations to ensure that those families are still receiving the educational support, you know, SEND support, etc., around that decision to home educate or electively educate their children, and around kind of ensuring that they're still in touch with pathways back into mainstream education, should that be something they're kind of interested in? So it would just be great if you could elaborate a little bit on that. Thank you.
In terms of we work within the statutory guidance for electronic education, and that was an area of scrutiny in the ILACs inspection. So the contact is annual, and it's to receive the plan from the parent that they are putting in place. They need to provide a suitable education, and the legal definition of suitable is it achieves what it sets out to do. So we have our schools in a position where they will try to encourage a family to stay with them. We have a position where to do the opposite of that, they know is against both DFE and CYC ways of working. And in terms of the support to go back into mainstream, we highlight those cases, we support them through our fair access placement to give them a return to mainstream school. And we have a leaflet for parents which signpost them to the best resources that they can consider, that we've drawn up carefully, and also to exam centres if they're of exam age. It would be fair to say that we historically have had generally people choosing for home education where they have had the philosophical preference for that, but our increase in numbers are often families where there may be presenting anxiety or mental health reasons, or there is a sense that their child is not suitable for the education offer that is available, either through SEN need or from elsewhere. Where a child has an EHCP plan, they remain underneath the annual review process when they're not in school.
Thank you. And I completely understand that we have incredibly limited provision, but so just to clarify, that is a massive gap and a massive area of concern then, if once families feel like they need to take that step for, you know, sometimes really difficult reasons. So it is then, in terms of their involvement with the local authority, an annual inspection of work plan and some leaflets and maybe a bit of kind of paper-based support, but everything else drops away.
Yeah, the ACDS, the National Association of Directors of Children's Services, have asked for the right to home visit, which is currently something which can't be asked for, and to have greater scrutiny. The Children's Commissioner has raised the concern about children who are unseen, and there is the stalled proposal for a register of students who are not in school. So I think people are aware that this is a gap. It's also a sensitive gap where sometimes those families are wanting less scrutiny from the system. So it's what the fair amount is that should be there, and how we can resource that are definite barriers.
Thank you.
Any more? Can I just have one then? the funding of that post, that's essential and ambition to longevity. It goes from January to January. So is there any change in who's owning that? Since we're going to change authority as well after May's election, we're going to have a mayor, we're going to have North Yorkshire coming in. Who actually pays? Because obviously the budget is set from one point of the year, and then this is going to go from January to January. So where does it fall? Excuse my ignorance of, you know, we're talking about the budget and there's these 12-month contracts. Where does it fall, and where is it going to change as the year changes?
The first post was paid for by
Yeah.
York Schools and Academies Board. So they'll in terms of which director?
The other position you had, the school attendance
Yeah.
advice.
So currently that's also been paid for by the schools. So in terms of things going forward, it would be a discussion. I don't think I probably have the tools to answer in terms of which director it would come from. If it's a budget setting, well, my understanding would be that we would have a gap prior to that.
Yeah,
budget.
just to clarify, both posts are currently funded via the central services block of the Dedicated Schools grant. And some of that funding is allocated to the York Schools and Academies Board. But it is actually, it's centrally retained around some of the statutory duties that a local authority has around education. So one of the things that we are looking at is the continuation of the funding around the data and performance post, based on the fact that it is around that centrally retained funding.
It's a bit annoying. Who does it fall down to? Am I talking of office? Are we talking Bob?
Councillor Nichols.
We're talking Bob.
I think it falls down to the Conservative government not giving anybody enough money. I've held off for that long enough, but that's the honest answer. Currently it's funded by, as Maxine's explained, so the Central Services block. So it's been a collaborative piece that's been done through York Schools and Academies Boards, which is essentially head teachers and CEOs across the city who've recognised that there is a need for this and a need to work together.
Yeah.
And that's something that they've chose to fund, and we can all see how that has been really important for the city.
But with the changes, you know, obviously North Yorkshire coming along.
So in terms of,
Is there any
opportunity,
the fact that
in terms of the mayoral responsibility, that changes nothing in terms of our role as the education authority.
Okay. Councillor Waller, you shook your head.
Thank you. My interest in ensuring there wasn't a cliff edge with this post, I would suggest that we ask, there's a report, would Councillor Webb receive a report to review ways of continuing this post?
I think it's, as I said earlier on, I'm happy to work with Dan to actually come up with what is needed, what makes sense, and then go from there, because I think that's a sensible approach.
Happy with that?
Cool. Thank you. It's not the government's.
Don't even try.
Lovely. We'll move on. I'm conscious of the time, but it's not been dull, has it? So it's flown by. Thank you, Dan. Work plan. So we have, obviously next month is fine, I think. Nobody's got any changes to the rolling forward. The bit to look at is task and finish groups. We've been requested by Stephen Fenton, Councillor Fenton, that food and insecurity task and finish group could do with some help, us participating with potential help from other places. It's quite important. Where's the email it came from? Have we got it? Have we got it? Where is it? I hate it. There we are. The Cresta Council Scrutiny function undertakes a review of community food growing opportunities and makes recommendations to executives to expand these opportunities, including considering the prospects of expanding the Edible York project in Town Hall to other parts of the city to bring more underused gardens into use for food growing. So we've been asked, because it's sort of one of those that crosses many areas, to come up with support for the task and finish group. So as they've, I think Emily replied saying, well, yes, but can we have some help, please? Which they said, yes, we can have some help. So is anybody very keen, allotment growers, to get involved in the expanding the Edible York project?
Of course, as I brought this motion to council, I'm very keen to be on
There
the
you go.
task and finish group.
Dear.
However, as a new councillor and new to the scrutiny function, yes, I would really appreciate some more weathered assistance.
Now, my understanding from my colleague on my left is that this is balanced. So Liberal Democrat gang team, have you got anybody who'd be keen to get involved in Edible York?
My hearing aids are packed up,
Oh,
so I'm struggling to hear you.
right. So we're looking for peeps for, well, I think if we get one more from this, we can get other scrutinists to participate, is in Edible York project.
This is around doing a piece of task and finish work, looking at community food growing in the city and seeing if we can open up kind of or find opportunities for expanding it, as per the motion that went to full council.
Might not be my bag, Chair.
Councillor Pearson, Councillor Waller, are you keen to get involved?
Can we come back to you on that one?
Okie dokie. And I will go back to Stephen and say that we've got one pending, and can they find another one?
But
I
perhaps
think
if we'd been more enthusiastic about what I've been growing in our garden, then I might have volunteered.
I'll go grass.
I think you need to volunteer, Councillor Mason. I think that's, if he walks out early, never mind, I think that's where this goes.
Oh, it's very, yeah. Shall we propose Councillor Mason? Oh, he's not the committee. Oh, he's lucky, isn't he? He's not the committee. Cool.
Chair, just super quick. If when you're feeding back to Councillor Fenton, you can think on, and I will also try to think on, pre-COVID, there was a piece of scrutiny work that was done across a number of committees around food insecurity. And all of the files and the partial reports, it was interrupted, unfortunately, by everything that happened and never picked up again. But there was quite a bit of work that was done, some of which may be relevant. I don't honestly know.
Well, give him a start point, won't it?
But I've got all the access to all the files, which I'm happy to pass over.
Brilliant. Right, so our own potential task and finish groups, which we'd put down, was school attendance and task and finish group, and also how to measure the lived experience of carers and young people task and finish group. I think, given how tonight's gone, probably school attendance task and finish group is probably one to set up from our own group. Have we any thrusting volunteers to go on the, unless somebody says I'm wrong and don't want to have a school attendance task and finish group?
Can I just,
You can, yeah.
one of the things that obviously has come out as a very specific piece of work is around EHCPs. So I wonder whether that might be one to start with and then move on to attendance when we get, but obviously it's just wanted to kind of remind everyone that's something that Max and everyone seems to have discussed.
My thinking behind it was that the attendance, I think, was more scope for getting stuck in. I think the SEN or the early stuff was going well.
The only thing I would suggest is that in my experience, it's better to have smaller, more focused, specific task and finish.
Yeah.
And then move on next and move on to the next, rather than
Broad.
if you have a big broad, you
Get
know,
lost.
let's look at school attendance. Well, we've just talked about school attendance for 3 hours and probably only scratched the surface.
Yeah.
And we know that there's loads of avenues that we might want to go into. So you could almost have a bit of an overarching theme of school attendance is going to be something that's clearly going to be quite a live issue. It's something that we might want to keep returning to, whether it's through task and finish groups, whether it's through reports coming through the committee. My strong suggestion would be that it's better to have really quite focused.
Yeah.
We're going to look at this particular issue. We're going to make some potentially tangible recommendations, and then, you know, you could deal with that and then move on to the next part.
Any of your views? That just Bob.
Yeah, I think I'd support that. And earlier on in this meeting, Councillor Crawshaw raised the idea of looking at scrutinising some of those pilot projects that we're looking at. That for me, that would seem like exactly what he's just suggested in terms of having a small targeted approach, which you could then come out of having done one and then maybe go into the next or change your approach later on.
Sorry.
I've just, again, totally agree, except that that's probably something that we'd want to look at in 6 months or a year's time, because those pilots have just started, and what we want from that will be something to kind of understand and get our teeth into. That would be my thought. Happy to take.
And we're scrutinising you, member Bob.
It's what's going to be helpful to you in
Well, that was kind of what I was sort of suggesting.
And likewise, Martin, in terms of, you know, for us, the role of scrutiny is to add some value, right? So
yeah.
Where do you need a bit of value added to be?
Yeah, and I think on that initial item 4 on the SEND update, for me personally, as I said, I do think that this is something where we could do with a consistent look at it. I think the attendance stuff later on, data will come out on a regular basis, and I think almost that coming to this scrutiny committee is certainly something that's really positive. I like the approach of having a more in-depth look at the numbers as well, but that seems like right for a full scrutiny committee. Whereas with the SEND, that there is so much going on there that could be looked at. And I wonder if picking out particular aspects of that would be quite valuable. And I, you know, leave it to you guys to sort of suggest what you think would be really important. But one thing that you mentioned was potentially looking at the background to changes in the numbers of types of EHCPs and aspects around why there's been changes. And something that I'm quite interested in is what we do when a young person presents with maybe a potential need, and what do we do before that diagnosis? And we talked about that difference between the medical model and the social model, didn't we? And I think that there's work in there really that will be quite valuable to inform decision making going forward. So from my point of view, that's where I'm at. But you know, it's up to you guys.
Any of the views?
We're very happy to agree with what Bob has just said. I think Councillor Crawshaw asked some really good questions actually about trying to get behind some of the data around EHCPs, actually where there are consistent themes and whether we're putting our funding and resources into the right places as a result of that bit of work. Seems to make a lot of sense in terms of connecting the dots.
Any other views? So the proposal is.
That seems like 2. Oh, sorry, Councillor.
So
Can I just understand what this task and finish group?
that's what I'm about to hear from Emily.
Were you asking the same question?
She's about to tell us what she's.
I mean, I think Martin just told us what that would be. So my understanding of all the conversations this evening is that there's a kind of clear need for a task and finish group looking at EHCPs and the data behind them in terms of what the officers were saying about how certain types of EHCPs have changed quite a lot. They said visual impairment's gone up, which is quite a bit of a surprise. Maybe there's something behind it, probably not, or possibly not. But certainly around neurodiversity, they were saying that lots of the data around and the numbers of neurodiversity EHCPs have gone up. So investigating what that data is and how that might inform the way that the council is doing EHCPs and the support that they're putting around certain types of EHCPs. Does that sound right?
Yeah, I think the little connection for me is about how is the council more broadly investing its resources as a system, because an EHCP is a system effectively, which isn't just the local authority, actually it's all partners as well. but how are we investing our resources to make sure that we can provide the right, so whether it's, you know, if it's mental health, are we investing our resources more in our mental health than neurodiversity? If it's about autism, is there something we need to look at around investing our resources around autism? So that's the bit for me about the connection to the council. Are we doing the right things as a local authority?
Cool. Right, who wants to, because we're not all on it. Who would like to be on a EHCP task and finish group? You're up for that, right? Good. Councillor Cuthbertson. Anybody else? Councillor Pearson, Councillor Waller? No. Oh, sorry. Cool.
I'm happy to if numbers and balance, but also happy to.
What? How many do we need?
Probably 3.
3. Oh, can I 4? There's 4. Oh, unless you don't want to be on it.
No, I've already got.
You've got one. There you go. We've got 3. Sorted. Cracking. What's next? Coco. There is no urgent any other business you'd be pleased to know. Are you on the clock?
Apologies. Just wanted to take the opportunity to say that we've had a focus visit on leaving care from Ofsted, and the publication of it's not a judgment, it's a letter, but that letter is published tomorrow. So what I will do is circulate that to this group. We're very pleased with the outcome, I think it's fair to say.
Yeah. On that good news, thank you everybody for your contributions. Sorry it went for so long, but I didn't think there was any waste of time. So thank you.